Hi, my name is Dr. Shah and I'm a consultant neonatologist and pediatrician at William Harvey Hospital, and I also do my private practice at One Ashford Hospital here in Ashford, Kent. Why did I go into medicine? I had a dream actually when I was a teenager. The dream was that lots of people are suffering and I need to do something about it. So I had two choices, either to become a politician or go into medicine and help these suffering people. And I thought medicine was an easier choice. And I can be true to myself and I can stick to my conscience without lying or without doing anything unethical. And therefore I went into medicine. So I always wanted to help suffering people. Pediatrics is fantastic because you work with babies and children are so innocent and cute, and they don't carry any baggages like older people do, like me. So it is always fun to work with them. The other good thing about pediatrics is that babies and children can become unwell or acutely sick very quickly. So if you have got diarrhea and vomiting, or if you get asthma attack or a seizure, these are the common emergencies we see in pediatrics. These babies or children can become unwell very quickly, but at the same time, if you recognize these problems very early and if you treat them correctly, they become well also very quickly. And then you can discharge them the next day or something. So most pediatric patients, they're admitted to hospital only for a day or two, and once they get better, they're discharged, and then we follow them up. So that's the beauty of pediatrics. The other thing is teenagers are a different group of people we see, or patients we see, and they are also fun to work with. It's always interesting to see. I always ask them this question: what do you want to do when you grow up? And that is a very interesting question, and that really helps me to guide them, particularly if they've got particular medical conditions. Then we can say that this is good for you, this is not good for you. So pediatrics is fun, but it can be very hard work. It can also lead to lots of late nights or waking up in the middle of the night, but it's all very gratifying. Particularly when I follow up these babies from birth till their teenage years, and I've done that to many of my patients, and it is really rewarding, very satisfying. So my typical day can vary from which day of the week it is. So one day a week I usually do my clinic, which in the NHS. And say for example, morning I would do a ward round and then do a clinic in the afternoon. Then one day a week, because I am a pediatrician as well as a neonatologist and a pediatric cardiologist. So one day a week I do ward round in the neonatal intensive care unit, and then I do a peripheral clinic in Dover or Folkestone, and then one day a week I do my cardiology work, which is looking at children with or babies and children with heart conditions, and then do the echocardiogram clinic. And I also go up to, before the pandemic, I used to go up to Evelina Children's Hospital once a week to do my cardiology work, take part in the multidisciplinary meetings. But with the pandemic, we are doing online now. In fact, I think in a way it is good. It saves me a lot of time. So I can do it online and do the same work. And then one day a week, I work in private sector. The most rewarding part of the job is, as I said, is to see these babies get better or children get better, and then continue to follow them up in my clinic. And when I follow them up in the clinic over a period of years, particularly those who've got chronic conditions, particularly those with heart conditions or ex-premature babies, it's very rewarding to see them grow up into fine young adults. In fact, recently I had a patient contacting me, in fact, to this hospital, in One Ashford Hospital. She said, "Are you the same Dr. Shah who looked after my baby 18 years ago? He was born very premature, about 28 weeks or so. And then the family moved to Australia. And then she was emailing me from, in fact, they emailed this hospital, and then somebody from the hospital forwarded that email to me. And then in the next email, when I said, yes, I am the same Dr. Shah, and then she sent me the photograph of this 18-year-old boy who was about to join uni. It was very rewarding to see that thing. I usually do lots of outdoor activities. I travel a lot, and with the pandemic it's difficult, but I've done lots of traveling, and I enjoy nature, and I like wildlife, and I also like playing golf and cricket, and in my spare time I will read a lot. And the other thing which I really enjoy doing is my charity work. So I have worked for charities which work for children over the last many years, and I'm trustee of 2 charities, and it's really rewarding to help these children who are very unfortunate. Mainly we work in areas where we want to reduce the risk of diseases, or prevention, not reduce the risk, but to prevention of diseases in children. So I work for a charity called Impact Foundation UK, and their goal is to prevent diseases in children. So it's more a prevention work, and it's very satisfying.